we could do. So we've got this scenario, we've got catastrophic climate change facing us, and we've got to ration carbon use, we've got to dramatically cut back CO2 pollution into the atmosphere to avert catastrophic climate change. But we could make our streets safer. There'll be less like that. Urban air pollution kills about 800,000 people a year. We'd have more of this. We'd have more physical activity. Physical inactivity kills about 5... Oh, I've forgotten the right number now. Who knows the right number? It was in the Lancet a few weeks... it's either 3.7 million deaths a year or 5 million. Anyway, it's a big number. It's lots of millions. It doesn't really matter. We'd have less urban air pollution. We'd have less of this. We'd have less of this. The whole, what's happened over time is the whole, if you imagine, if you measured the body mass index of everybody in London and plotted it on a graph, you'd see a distribution. So there'd be a few really skinny people, and then the bulk of the population, and a sort of fat tail going out that way. What's happened over time is this whole distribution has shifted. Actually, so, you know, there's a focus on obesity, and it's silly. Obesity is a silly concept, really. It's a dichotomization of something that's inherently continuous. So we're all getting fatter. You know, you're fat, I'm fat, the Queen's fat, everybody's fat, because the whole population distribution of body mass index is shifting. As countries around the world are motorizing, their body mass index distribution is shifting too. So if we're going to, I mean, it's also about food, but it's very much about movement. It seems to be more about food than it really is, for a very obvious epidemiological reason. It's that because we're homogeneously sedentary, what differentiates fat and thin people is their food intake. But that's only because we're all sedentary. It's just like that if we were all smokers, what would differentiate people who got lung cancer and people who did not would be something else. It'd be like genetic or dietary factors or something like that. We'd miss smoking as a cause. But movement is the cause of fatness, but we don't see it because none of us move. So it would be less fatness. Hugh's already mentioned that meat, in terms of climate change, meat is heat. Because if you grow cattle, it uses a lot of land, and that leads to deforestation. And cattle belch out from both ends methane, which is a very powerful greenhouse gas. And so we would have to dramatically reduce meat consumption for reasons of climate change. And that would be tremendously good news for our health as well, because overproduction of animals, overproduction of livestock, just puts a sort of a river of saturated fat into the food chain. And saturated fat is a cardiovascular poison. Most of us in this room will die from saturated fat. So if you took out saturated fat from the food chain by producing less cattle, it would be good for climate and dramatically good for health. So this is, you know, climate disaster. So there'll be less chronic disease. Then you've got to remember that most of the wars in the last century were resource wars, and the resource that they were really going for is oil. 2 million, was it 1 million or 2 million people marched through the streets of London some years ago saying no war for oil, and they were talking about the war in Iraq. Now, Tony Blair said it was about weapons of mass destruction, but now we know he lied. And if, you know, you can't separate your own use of fossil fuels from these, I'm going too slowly. All right, okay. So really nasty wars. We've got to get away from this. And then inequality. Well, the policy that best addresses inequality and climate change at the same time is contraction and convergence. Carbon budget, sharing out, global redistributions of wealth, towards people. You know, we'd have to buy the unused carbon rations of people in Africa who live on about half a ton of CO2 a year. and the people in the United States would be having to buy them who actually consume 20 tons of CO2 a year. So that's the story. So climate change is a disaster. You've had those two, you've heard that. Mitigating climate change could be the best thing for public health. Thank you.